Now, nearly half of India's population falls into the category of borderline or unhealthy as per Goki India's Fit Report for 2024. The study is based on data from its user base of 6 million people across India. It underscores that a significant gender divide in health outcomes still exists, finding that 59% of women were categorized as unhealthy compared to 40% of men in the category. High blood pressure is also found to be a common ailment, followed by the likes of high cholesterol and diabetes. Vishal Gondal, the CEO and co-founder of Goki, is with us to highlight some of the key findings from this report coming in now. Vishal, thanks very much for your time here on CNBC TV 18. Just to summarize for our viewers, what would you say is the biggest change that you've seen in health outcomes in 2024 compared to what your reports found in the earlier years? Because, how healthy really is the average Indian today?
See, so far, most of the health data and reports were coming either from hospitals or from, let me use the word, sick care side. Goki released the first report in 2017. So this is almost our 7th or 8th year. And we've been looking at longitudinal data of how Indians are changing their lifestyle, how activity levels are changing. And clearly, we see that certain pockets and certain cities with good infrastructure, less pollution, tend to be more healthier. I mean, we saw cities like Surat and Indore performing really well because of the underlying infrastructure and the pollution, etc., in the city itself. So clearly, it is, if you look at the city level information, we are able to see disparities between certain cities where health is very good comparatively because of the city itself. The second thing we are seeing is there is definitely high level of awareness, but still there is a challenge in terms of people able to actually adopt healthy lifestyle. And that's partly because India is currently filled with junk food. Every app, whether it is Swiggy or Zomato, is dishing out, biryanis and burgers. And similarly, there are apps which are doing quick deliveries at home. So you are even not motivated to walk. So there is a lot of things in the environment which is contributing to the poor health.
Well, I find myself guilty of a lot of things you just highlighted, Vishal. But since you talked about the geography, let me quickly get a word in on that. Patna, Kolkata, Lucknow, Bhopal, most unhealthy cities as per your report. Surat, Jaipur, Chandigarh, relatively better. What we don't hear here is the metros. Any particular reason, of a trend that you're seeing or not seeing in metros versus the tier 2, tier 3 cities, or any changes that you've seen over the years for the likes of Bombay, Delhi, etc.?
See, metros, the awareness is very high. There is you can see Mumbai has a marathon literally every week happening of some kind. But the problem with metro cities is the construction, the pollution, and overall, you just can't walk in a city. Like, Bangalore is always having such high level of traffic jam. So stress levels actually are higher in the metro cities. Another thing which is very, very alarming is the amount of women who are having healthcare issues. And we know that women as a biology itself have a lot of women's health related issues, whether it is PCOS or fertility or women's health kind of issues. So women actually are bearing the brunt of the whole health challenges. And we also see that women always tend to underestimate their health, but they always want to care for their family or other people while they don't take care of their own health. So I think that was one other very interesting thing, that women consider themselves as super women, which they are, but they should also be equally worried about their health.
Well, everyone should be worried about their health. But, just to take this gender divide in health outcome debate forward, you've explained some of the reasons why this may be the case. But what would you say are the challenges that are unique to women when it comes to their health issues?
I think with women, clearly, what we see is that, there is thyroid, for example, is very prevalent in women, and thyroid is also connected to weight and so on. And that's also connected to the menstrual cycle and so on. So I think there is a much more compounding of these health conditions in women, which is what is happening and which is what we are seeing. If you really see whether it is blood pressure. So a lot of these are connected with each other, and that is what really is coming out. The other thing which we are also seeing is that if you see the data, whether it is diabetes, thyroid, high cholesterol, and blood pressure, men are more prone on the cholesterol side, but women have the thyroid issues are almost entirely dominated by women.
All right, let's step away from the gender and enter the age category now, because globally, of course, we've been hearing lifestyle diseases, hypertension, stress, cholesterol, etc. These are seen as big reasons for health deterioration, but increasingly also not just affecting the senior citizens or the, people who are slightly older in age, but also the younger people. What are some of the outcomes here that you've seen in India?
So clearly, we are seeing an early onset of diabetes. For example, if you see clearly a 3-4% jump in people early detection of diabetes. So there is childhood obesity, which is connected with also diabetes. So that's clearly coming out in the data. The other thing which we are seeing is that the minute you are crossing 50s, suddenly there is a huge spike in all the related diseases. So today, 50 or 45, I would say 45 to 50 is that band where the minute you're crossing that, you are completely getting inundated with all kinds of lifestyle issues. And finally, what we are also seeing is that when it comes to health, there was a recent report which talked about cancer on the rise in India. In fact, there will be a very, very high propensity of cancer-related cases. And that's completely coming out here, right? Because Goki is giving you the lifestyle data.
Sure.
This is what is translating to things like cancer and other things. So if you really see the trend, a lot of this is contributing to that part.
Okay, very briefly, since we're running out of time, the report also says that young adults between the age group of 20 to 29 are the most stressed age group. We've been talking about mental health issues here on the show earlier today as well. Despite the fact that there are more tools and forums available for help today than before, what is the trend that you're seeing? Is there an improvement, or is it only getting worse with the advent of social media and so on?
Absolutely, right. I mean, this age group and the teenagers are spending an insane amount of time on social media apps. They are addicted to what I call digital dopamine. And this digital dopamine and the constant need to get recognized and the constant need to get engaged and stimulated is certainly creating issues like ADHD, depression of all grades. So clearly there is a big challenge, and OTT platforms, we know that, for example, sleep is very important. It's literally the foundation of good health, and we are seeing sleep getting deprived. And especially in the younger people, the sleep is even more challenging because most of them are binging on some of the other OTT shows. So I think the content consumption environment is what is causing a lot of these things.
Okay, Vishal, unfortunately, we've run out of time. Very interesting findings there. Thanks very much for sharing them here on CNBC TV 18. Thanks, Vishal.
Thank you.
Well, with that, it's a wrap from Ritu and me, Shruti, on this edition of Startup Street. Stay tuned for more updates.